Hello and welcome. This is Hands on Health, the podcast all about living your healthiest life on the coast. I'm Austin Miller.
And I'm Alyssa Evans. Today we're sitting down with Renee Skeels, the Manager of Health Information Management at Columbia Memorial Hospital. Thanks for joining us, Renee.
Thank you for having me.
Today we're going to be talking about health information management, and hopefully you'll be able to learn a little bit about what the department is at CMH and get some tips and maybe some information that'll help you have a great experience the next time you're at Columbia Memorial Hospital. To get started, Renee, do you mind talking about what services HIM provides for patients?
So the services that we provide for patients is that we maintain a health record for them, and we maintain the information so that we can release it to them or to their other providers or to anyone that they would request that we release information to. We also give them an option of having direct access into their MyCMH chart, their online chart that they are able to access through the patient portal. And we can assist them with gaining access to that so that they can get direct access and not have to come in or not request from us the information that they want. But we are happy to help them at any time with getting additional information from either other providers or just providing them with what we have here.
Could you maybe go into depth a little bit about what kind of records patients should have a copy of? What kind of records are we dealing with?
It's all of their medical information. So it would be any hospital visits that they have, any provider visits that they have, if they get seen in the ER, especially if they have ongoing conditions. It's really important that they have that information available for all of their providers. And some individuals, because they travel or they go south for the winter, they want to have copies of all of those records with them so that if they need health care somewhere else in another location, they have very quick access to it.
That makes total sense. Do you mind explaining how patients can go about getting their records through working with HIM?
Yeah, so they can do it in a couple of different ways. The easiest way or the most direct way is the patient portal that they have direct access to, and we can help them sign up for that. And they can go into their chart, they can gather information that they want, they can print it, they can communicate with their providers through the patient portal, they can set up appointments. So there's a lot that they can do. It also will have a list of their medical conditions. It will have a list of their medications, and they are able to provide that to whoever they want. If they are not wanting to do it themselves, we can do it for them. They can come in, we have them fill out a release of information form, and we provide the records for them. We will print them or we will provide them electronically, whichever they prefer, and give them copies of it or make a copy on a CD for them, or it could even be through email that we will provide the records for them. It's really based on what their preference is.
Kind of on that, obviously, you mentioned the patient portal and that we have a lot of online records now. In your experience, how has record keeping changed in the hospital system over the years?
So the records have changed from a paper format into an electronic digital format, and it really has become more extensive, the documentation. Rather than providers having to write out everything, they can now enter it electronically, and it is a much more detailed record of what occurs at the visits than what we used to have before. Even with the hospital visits, the records are much more detailed than what we used to have or be able to provide for patients previously in the paper format.
Oh, wow. So does that help impact the quality of care then?
That would impact the quality of care. The more detailed you can be about what is going on with the patient, it helps the next provider know what we did, exactly what we did, what care and services we provided, and they can make their decisions based on what we've already done.
That makes sense. And I can see how that would be really beneficial for people. Do you mind sharing an example of maybe some of the ways that that information has expanded? I know you said it's a lot more than what it used to be. What kind of paperwork and information has been added on?
The additional paperwork would be just more extensive documentation and more of the documentation from ancillary services. So the nursing documentation is much more detailed than it used to be. All of the ancillary departments, radiology, lab, that is all a lot more detailed than what it used to be also. And so we are able to provide all of that information for ongoing care or for any other need that they might have. They might need it for insurance or for billing. Sometimes individuals need it for life insurance that they want to obtain, and sometimes just for attorney type of issues where maybe a patient needs help with their care, and we are setting up that somebody has healthcare power of attorney for them.
Wow. So essentially then it's become easier then to store this medical information, and we can store a whole lot more of it too.
Yes, and it's much more legible than just handwriting information on paper. This is typed out information that looks much better, much easier to read, and much more detailed.
How long of a transition was it to get all those? I mean, obviously before we had just those handwritten records, like you said. Was that a difficult process getting that to be digitized?
We started with electronic health records a number of years ago. Most recently, about 8 years ago, we went to Cerner as our electronic health record, and we imported some information into our system regarding our current patients at that time. We did not import all of it. We do still have paper records and other electronic healthcare records that we have available to us should we need them. But we do have about 8 years worth of data into our system currently.
That's really impressive. Kind of switching gears a bit, do you mind explaining what the different roles of HIM employees are and the different types of things that they do? Like, for example, how does maybe if a patient was coming to the hospital and working with HIM, would they work with multiple employees in the HIM department?
So we have in the HIM department 3 levels of HIM specialists, and they all are assigned to various activities. And then we have a supervisor who supports all of their activities and does all of the training so that we have consistently the same training going to every person. Our release of information specialists are the ones who work with the patients the most, and they are the ones that will work directly with the patients to fulfill whatever it is that the patient is requesting as far as records, and to help them get information if they need it to other providers. And they will know the laws, regulations regarding the release of information. It is highly regulated. We have HIPAA guidelines, federal and state, that we have to follow. And so we are required to meet those guidelines in order to release information. We have a release of information form that patients will fill out to let us know what it is that they want and to who they want it to go to. And so once that is filled out correctly and appropriately, and we review that with them, we then will take their request and complete it. We copy a lot of records for continuing care, send it to other providers, other facilities. We do a lot for patients. They either want it for their own personal records. Children need records for school to be registered. They need records for various activities in sports. And we provide records for life insurance companies, for medical insurance companies, so that the bills are paid for the patient upon their request. And then they will also help with the patient portal and getting patients onto that and signed up and successfully using that. Our second HIM category is a HIM specialist who works on the review of our medical records to make sure everything is completed and that we have everything that we need in order to bill the patient's insurance. We verify that everything is there, and then we send it over to Patient Financial Services, all of the encounters, so that they can be billed for the patient. And then we also have individuals who scan documents, outside documents, into the chart, or paper documents into the chart, those things that we don't do electronically. They scan all of that into the chart, so it is available for providers and or the patients. We also are purging all of the older records. So the older records that we have of patients who either are no longer seen here or that are older than 10 years, we are destroying those records. We may have copies of it already in their chart, but the old paper records, we are going through those and destroying them. And that's primarily our functions.
That's a lot. That's impressive.
Yeah.
And I know that doesn't even cover everything.
Sounds like you guys stay quite busy over there.
Yes, we do.
Well, Renee, is there anything else that you would like people to know about your department? Anything that we haven't talked about already that you would like to?
I think that we just want people to know that we're here to provide a service for them and to find a way to provide for them what it is that they're requesting. We have to do it legally, but we are very interested in finding those solutions for them when it's a little bit more difficult. We also are providing a service for those individuals who it's either difficult to come into the hospital and walk to the department, or it may be that their health is such that they can't do it. We provide a drive-up service for records also, so that if they want to complete the request for information and let us know when they're going to be here, we will go out and deliver their records to their car right outside of administration. And all they have to do is drive up and give us a call and let us know they're here.
Wow, that's awesome. Well, thank you so much, Renee, for all that you guys do over there in the Health Information Management Department, and also for just coming with us today and explaining a little bit about what it is you guys do.
You're very welcome.
Thank you again for joining us today. This has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us again next time for another episode of Hands on Health.